Hello, my name is Adam Funk and I'm a birth injury attorney. Today I want to talk to you about cooling therapy, when it should be used and why it should be used. So cooling therapy is something that is used by hospitals and neonatology teams in order to slow down the process of a brain injury. What ends up happening is there is a lack of oxygen that occurs during an incident, whether it was during labor or delivery, but the baby doesn't get enough oxygen one way or another. When that occurs, there is an initial insult to the brain. However, that's only the first phase of brain damage. The second phase of brain damage involves an inflammatory process which continues to kill off the brain tissue. That is the part where cooling therapy tries to slow down. The most important thing is that cooling therapy is actually done within 6 hours of birth. If the baby is born and doesn't get that cooling therapy within 6 hours, then there's no point of actually cooling down the baby. Typically, a baby is cooled to around 33 degrees Celsius, and it is a very prolonged process that lasts about 2 to 3 days, depending on the severity of the hypoxic event. A lot of hospitals do not have cooling therapy, and therefore a transfer is requested and taken to a much bigger hospital at a bigger city. Cooling therapy can only be done if the newborn actually meets certain criteria, such as low APGAR scores or an actual event that occurred that caused oxygen deprivation. If your baby had cooling therapy after he or she was born and you have more questions, you have to talk to a birth injury lawyer. There might be a case here that you need to protect your baby's legal rights. My name is Adam Funk, and I am a birth injury lawyer.